Hi, everyone. My name is Iris J. Gilday, and I'm an associate professor at the University of Toronto. And I'm also trained in the expressive arts, and I have a one on one practice and do community work. That's Gus, my dog, who's video bombing my presentation. He's done it so many times, I'm just allowing him to stay. Yes, so I also have a practice and I work with folks at the intersections of self inquiry and art as way of knowing and healing. And I am talking to you today about a lot of that. So my presentation is called Speaking from the Body, Autoethnographic Aesthetics, a Spiritual Practice for Grief Tending. And I find myself making this presentation for you um, in a little room by the ocean. So I thought I would forsake having perfect light and let there be some ocean in the background as I'm chatting with you. And I will be using my own autoethnographic examples to open up these intersections of art as way of knowing, art as inquiry practice, art as qualitative research method, with the intersections of grief tending and spiritual practice. And so I thought I would begin with art, with these autoethnographic aesthetics, with this image. This is an image I made many years ago when I first began really bringing into a focus of my life healing from a very traumatic childhood that involved childhood abuse and all of the intersecting family and social dysfunctions that accompany childhood abuse. And the focus of my work, both as an autoethnographer, but also as a feminist trauma theorist, is to highlight the intersections of the body, art as way of knowing, spiritual discovery, spiritual reclaiming, and joy, and healing, and thriving. And perhaps that's why I come to art as a way of knowing, because it is inherently creative. And I think at its best, theory and theoretical work is also inherently creative. That said, I think we have also found ways to reduce and categorize theory into ways that strip that creativity from its inherent vitality. But to focus on art, so much has shown us that trauma resists and rejects linear language. And the ways of healing ourselves and coming into deeper and deeper relationship with ourselves and self-love and self-forgiveness involves other ways of knowing, ways that categorical, explicit, cognitively driven, rational, pre-established units of meaning, which are all the basis of Western psychology, don't necessarily know how to hold the complex, interrelated layers of selfhood and relationship and body that are to heal. And that is a big part of why I come to art as healing, art as way of knowing. And what happens when we intersect various aesthetic discourses. So some prose and verse that come with this image. See her, seeing me in shadow and in light. Her breath I know is deep within my womb, and yet the touch of that divine knowing escapes thought again and again. I am sent downward to the depths, my psyche trying to break free. Her breath trickles down my spine, the wound opening. I look inside. She is me, as they, as all of us bound together, and the moment light sheds itself upon the tragic loss of mother, brother, sister, father, loved ones hanging on the edge of despair, forgiving love. The will to rise one more day out of bed and meet the morning, her breath trickling down. It's interesting when we come to traditional trauma theory and traditional perspectives of psychology, the majority of literature and scholarship available for studies of childhood abuse and healing begins with what feminist practitioner Bonnie Burstow called the deficiency practice. Within the first paragraph, within the first few words of what we read, we learn how the survivor is less than normal because of experiences that were almost always completely out of her, his, or their control. And the deficiency praxis works by setting up the idea of normal vitality, normal mental health, and all the ways that the survivor of childhood trauma has to learn to reconstruct her psyche to become normal, to become functional in a traditional way. And what happens when we peel back the layers is not only do we see that that idea of normal is an interpretation of data and knowledge and facts that is interpreted within a traditional colonial patriarchal lens of identity. But we also see that in the very roots of these models of trauma theory, they're written for the most part by folks that are not survivors. They're written for the most part by folks who don't know what it is to be embodied in inherent, courageous structures, psychosomatic relationships of complicated understandings of love and complicated understandings of relationship. And so much feminist trauma theory from this perspective disagrees with traditional pathology, disagrees with traditional modes of any standard of deficiency practice. And I am such a feminist practitioner. And it's part of why I come to the arts and how the arts can become part of constructing survivor-centered modes of inquiry, modes of healing, modes of identity making, both for the individual and for cultural dialoguing, for cultural understanding. When we come to understand the arts as a way of knowing, oftentimes the arts are used in healing practices as, I think, in a greater scope, still deficient. We'll go into the arts and we'll do our art making and we'll have something happen, and then we'll translate that experience into explicit language. Then we'll translate that into cognitive demarcations of categorical understanding that are rooted in what some Indigenous scholars call cognitive imperialism. And so my curiosity is what happens when we learn to allow art and embodiment as a way of knowing, as a way of meaning making, that absolutely intersects with traditional cognitive demarcations of meaning, as I'm doing by bringing theoretical prose right now into this conversation. But what happens when we allow a more integrative approach? And what happens when we reconsider healing, especially from childhood trauma, but from trauma in general, I think we could also say, in terms of grief tending. Grief is rarely mentioned in terms of childhood trauma and healing for adult survivors. And in my experience, it's the bulk of the work. And when we come into places that are capable of holding the complex layers of identity and emotion, which I feel art is much more suited to do than traditional language or talk therapy, I think we can come into such creative and beautiful practices. And the other piece, as my title suggests, that I have experienced myself through my own journey of healing, through working with others, through studying various wisdom traditions, is the way that when we reframe healing, to allow for the layers of grief to be communicated out of the body and into aesthetics, where that communication process through aesthetics is inherently creative. We also open up relationships with our spiritual aspects of selfhood, our spiritual realms of being and meaning making, where these for certain folks might intersect very traditional religions. For others, spirituality refers to an aspect of being such as one's emotional or psychological aspects of being that are not related to religious traditions, opening room for both, however we encounter our spirituality, and how art has a way of communicating these dimensions of being that intersect our healing, that intersect our rootedness. So some words that come with this image through this. I don't have time to talk about my own expressive arts practice, but the expressive arts practice that I work with and that I teach is very much a stream of consciousness, encouraging a genuine practice of coming into states of expressing through various mediums and really resisting any judgment of the art or words that would rely on more of a commercialized understanding of art and or a colonial patriarchal practice of meaning making that comes into judging good or bad art. This is an expressive and embodied practice that one can choose to shape, one can choose not to shape. We could talk more about that when we meet in terms of what practice looks like. But some words that come with this image: perfected rhythm, waxing and waning, such inherent fullness of evening's moon, held deeply in this body's life-giving stain of crimson womanhood. Inhale, she wakes. Exhale, she sleeps. So there's lots more to say, especially about the theoretical intersections of feminist trauma theory and paradigms of meaning making and qualitative research and art-based ways of knowing and land-based ways of knowing that tie into my own spiritual practice. And I really look forward to hopefully having engaging conversations with you about these ideas when we meet virtually. So I think I'll actually just leave it with that. And thank you so much for your time. And I really look forward to getting together.